Well, the whole world has been talking about football.
Heck yeah. Not
but
your kind.
Not the kind that I played. Football. The World Cup has us thinking soccer here at home. The Minnesota Aurora just played in Seattle. Unfortunately, they were knocked out of the playoffs. I have some words about that because there's no way they should have been playing in Seattle in the first place. They should have been playing here.
Wind 'em up.
They ended up their regular season with a perfect 12-win record. Well, our next guest helps work to help keep the soccer athletes safe, and they help them recover from injuries that they sustain on the field.
Yes. Okay. So joining us with tips for soccer players to potentially avoid injury, plus some treatment options if they do get hurt, we have a doctor and orthopedic surgeon with Twin Cities Orthopedics and the team physician for the Minnesota Aurora, Dr. Christie Heikes, is here with us today.
Nice
to have you here.
Thanks so much. Happy to be here.
You've got a big job. That's a lot of pressure.
It's a really fun job, so I love it. I have a lot of fun.
These elite athletes are serious business. Okay, let's talk about the World Cup. Everybody's been watching it. Really, I mean, I think just particularly in the U.S. where we're not as huge of a soccer market, people are just so into it. But the injuries, okay, what are the things that most commonly happen to soccer players, really at any level?
Sure. You know, there are a lot of injuries that happen with any sport, but soccer really has ankle sprains, for example, is a really common injury because a lot of times, especially younger kids, play on uneven pitches, and you're stepping on other athletes' feet, and it happens a lot. And then there's, knee injuries are also common. Soccer's a really high-risk sport for ACL tears, and that's a big injury because it often involves surgery and a long road to recovery. And so that's another common injury that we see a lot.
Yeah. I know the big thing in the American football world lately is Achilles injuries. And now there's a whole lot of research on like why all of a sudden we feel like we have a huge number of Achilles injuries. Is that a common injury with soccer players as well?
Not nearly as common as American football right now, for sure. There are other sports that are higher risk for Achilles. Gymnastics is one, for example. But not as much in soccer, although it does happen, especially as we have some of the players that have continued to play along as, they've grown older, and some of the, co-ed rec leagues that go on later in life, more overuse kind of injuries, but not the acute type that we're seeing in the NFL.
I'm interested in your perspective, too, on particularly with kids. I mean, we both have kids in sports, and that tendency that they're now playing year-round, that it just really early starts playing so much. Does that lead to some overuse concerns because they're maybe not as multi-sport athletes as we used to be when we were kids?
Yeah, I think there's two things that go into play with that. One is actually the kids, the youth sports scene, those kids play more soccer than the pros.
Wow.
The pros have very dedicated and protected time away.
Yeah.
And the kids don't get that. And so overuse injuries are actually more common in the younger populations than the professionals.
That is fascinating.
That makes a lot of sense. I never heard it like that. Let's take it maybe from a parent and maybe thinking about kids as well. Let's say you're watching your kid out there on the soccer pitch and kid slide tackles your little Johnny and he's down. What is the best treatment for like what happens in that moment? Like, are you like, come on, get up, like walk it off? Or like, when do we know like to push our kids through an injury or to like, no, we need to have somebody, a professional or maybe like you come over and treat the player?
Yeah, the first thing is give them a second, right? Give them a second to catch their breath. A lot of it's just really scary, especially the young kids. After they've caught a second and had a minute to catch their breath, the other thing I would say is when you're at the sideline, you're actually looking at them and talking with them about what has happened. I would say that if there's any sign of obvious swelling is a huge red flag. Don't let them go back out on the pitch.
Like right away?
Yeah. Right away.
Yep, okay.
Yep. And if they can't put weight on it is the other really big red flag, I would say. Those are types of signs that I would, bring them in sooner rather than later.
Yeah.
Okay. What are you guys doing in terms of preventative care, too, to kind of help athletes stay on the field, help them even just be mindful about caring for their body? Kids and young pro athletes can really feel like they're invincible.
Yeah, definitely. That's a mindset. And it most of the time serves them well. But being prepared and being well trained, they have to depend on their coaches for that expertise. And there's a really great program that our experts at the training house offer, particularly for sports that are at risk for ACL injuries, where they can take them through a series of tests where they're jumping, they're landing, they're doing things, and they can actually measure and kind of, they assess it by giving them a red, a yellow, or a green light as to the form that they use, how they distribute their stress, which then can correlate to injury risk. And so we can kind of identify areas where an athlete might be at risk. And so then we can tailor a program to make gains to then try to prevent that injury.
Okay, that is incredible.
Yeah, so you're talking like maybe like a muscle weakness that they didn't even know that they had. You're like, oh, I can run and I can cut and I'm agile, but then you realize after doing this test, well, your left hamstring's kind of weak. You know, we need to get it stronger, as strong as your right hamstring. Is that sort of the things that you're talking about?
That's exactly right. Making sure that the muscle groups are balanced, and so that as they do things, that force is a little more evenly distributed across that joint. Or, for example, jumping and landing and cutting techniques are also pretty critical to decrease injury risk, particularly for something like an ACL. And so that can be really helpful, knowing at least that you've done everything you can to put your athlete at the least risk possible.
And then you want younger athletes to start getting ready now before tryouts. Don't just like leap into it a couple days before.
Yeah.
Even though you're young and you're really
And you
strong
are
and you're
invincible.
at your peak, get into it now.
Yes, put in the time now so that when you show up to practice, you know, you're not out of shape, which puts you at more risk.
Yeah.
And, you know, those 2-a-days are hard, even on these young, really fit, really strong athletes. And that sudden increase in activity, even from their high level of baseline activity, can really put them at increased risk. So putting in the time and making sure they're rested and ready to go.
I think that
Yeah.
message needs to go to middle-aged dads who decide to run a marathon to relive their glory days. And they haven't done it in
So
a while,
true.
right, doctor?
Yeah,
Yes,
yeah.
yes, exactly.
Thank you
Yeah,
so
thank you.
much.
Good to
Yeah,
see
thank
you.
you.
Really helpful.
And I think it goes without saying, in this heat, please hydrate.
Oh my
Everybody
gosh,
hydrate.
yes.
All right, Twin Cities Orthopedics and Training House work in tandem to provide world-class sports medicine and sports performance expertise to athletes at every level of competition.
So Training House prepares athletes to perform at their best, and then if injury strikes, TCO urgent care locations are open 8 to 8 daily. Just have their number right there in
Been
your
there.
phone. Yes. If you want to learn more, visit tcomn.com or traininghouse.com, spelled the German way. We've got those links for you on twincitieslive.com.